Those are all patients with metastatic castrate-resistant disease. Some of them were from the CU302 phase 3 trial, so in the pre-docetaxel setting. The other one were from the CU301 trial in the post-docetaxel setting. And the question was really in this analysis whether we can use the Gleason score to help us decide whether a patient is likely or not to benefit from abiraterone. And so it's a big set of patients, and it was a good opportunity to look at this question. Actually, we have lots of data supporting that the Gleason score is very important in naive patients, so in localized disease, or maybe in patients who have not received any treatment. It's a strong prognostic factor, not necessarily predictive factors for efficacy to a given treatment, but strong prognostic factors. Now, when it comes to castrate-resistant disease, things were already less clear, whether Gleason score was important or not. But many people thought that the Gleason score might actually help decide whether a patient is likely to benefit from an endocrine agent versus maybe a chemotherapy agent. And that is really why we decided to set this analysis. We actually treated these patients with abiraterone prednisone versus prednisone alone. And of course, there is an improvement in overall survival, generally speaking, in the whole set of patients. But when we looked at the Gleason score, actually the results were quite the same in patients with a high Gleason score as compared to patients with a low Gleason score, which shows that abiraterone works in both situations. And that's a very important finding. You should not base your decision on the Gleason score to decide whether a patient should receive or not abiraterone acetate. And this is very important because, again, many people thought originally that patients with a high Gleason score should maybe not receive abiraterone, but rather something else, including chemotherapy. And it's not the case. It then showed that these patients do benefit from abiraterone, as patients with a low Gleason score also benefit from abiraterone. The simple message is that if you have to decide whether a patient should receive abiraterone, yes or no, you should not base your decision on the Gleason score. You should take maybe other criteria to decide for that, not the Gleason score.